Hi, I hope everybody can hear me. So as Susan said, I'm Erin John, and I've been with Valley for the past 4 years almost. I graduated from residency from in Montclair Mountainside Hospital, and since graduation, I've been part of Valley, and it's a thrill for me to join you guys today. And I hope we'll have a good session. So today, the topic I have is welcome to Medicare. And I'm just going to talk about what that means in particular and what you can expect for that first visit. So typically, this is the first physical exam you'll get after you've joined the Medicare within the first 12 months of joining the Medicare Part B program. And that typically happens at the age of 65. Now, there are situations where a person might qualify for Medicare before the age of 65, but typically that's when we expect majority of the people to join Medicare. And then, as you know, Medicare has multiple parts: Part A, Part B, Part D, Part C. And really, for an outpatient standpoint, it's really Part B that we'll be talking about today, and what all that first initial encounter for Welcome to Medicare visit will kind of include. So I do expect my patients, so I see patients in my office here in Fair Lawn, as Susan suggested, and I've seen patients for a number of years. So when I see them, I don't need them to bring in all their medical records with them. But I do expect, if it's a new patient, especially for a Welcome to Medicare, that they would bring me their recent medical history, medical records, especially if they're transitioning from a new doctor, and their immunization records. So that usually gives us a good understanding of where a patient has been, let's say in the last 5 years at least, okay? I also would like my patients to bring me, like what I say, bring your bag of medications if you're, and that includes any over-the-counter supplements that you take, because as a physician, that helps me kind of understand what conditions that you're treated for, and also if the supplementation will help us or is it interfering with our treatment plan. Family history, that's very important. I think every person should have a good understanding of what their family history is. And then that also brings about more questions about what screening that we need to approach for each patient. Okay, so that's the basic things I expect my patient to bring in with them when they're scheduled for their Welcome to Medicare appointment. So now let's just go into what all that sort of covers as to like what all you can expect for that first visit. So usually Welcome to Medicare is more of a sit down, talk with your provider. The provider goes into the details about your medical history, your surgical history, your family history, as I said, and then they go through your current medications, your supplements that you're taking, your allergies that you're taking. More than likely, I've had multiple patients on a number of occasions who've had issues with which medications they take, what time, and God forbid not doing it appropriately as what we advise. The other thing that the provider will talk to you about is about your diet, pretty much taking more time into going into the details. Your physical activity, that's another part that we discuss in detail. We also talk about history of alcohol usage. We talk about smoking cessation. We talk about other illicit drug use. And typically, we're more focused on the opioid abuse. So if there is a need, we will go into detail for that. Another important part of this talk is also screening for depression. Unfortunately, that's one aspect that has been overlooked, or actually now we're doing much more with regards to dealing with it better. And Medicare has set up a good program to kind of address that from the get-go. So having that screening tool in place, and either the provider or they'll give you a list of questions, typically 9 questions or 2 questions depending on the questionnaire, and they go in through the details with the patient to make sure if there's some underlying issues that's been going on that needs to get addressed. Another important one is your balance and stability testing. So that they'll either go through it with, or most likely they'll go through it with a questionnaire as well. If you're coming in with a family, they'll ask them about questions regarding that. And of course, an overall level of safety in the household. Now, you might ask me, I'm only 65. Why are you asking me all these questions? But that's a good baseline for us to see how things are changing, if any, in the future. And this gives us like a good understanding, or even for a patient to expect what all they need to consider for the future. Planning, I think, is probably the best way that we can help prevent any catastrophes, as I say. Now, the other one that all the testings, especially with the Welcome to Medicare, is also a hearing test. And they might either do it through history or through asking. Another way that they might do it is to refer you to an audiologist. And vision screening, that's another one that we do. Your height, your weight, your blood pressure. You can talk about your BMI. BMI is your ratio between your height and your weight. And I talked to you about the visual screening. That's an important part of that initial Welcome to Medicare package. Another one is your mentation or your memory, as I say. So they could ask a few questions about that as to what they need to do with regards to cognitive testing. And usually the provider or even the MA asks you a sets of questions to kind of determine where they are. And then depending on that, we would decide what needs to get done moving forward. Another important part of the Welcome to Medicare package is what we call the advanced care planning. And this is not, I tell my patients, like, please do not consider this to be like a morbid discussion or anything, but it's important because later on in life, it becomes a burden for the immediate family members to kind of have that sort of burden on them to make the decisions for you. So advanced care planning is when you talk with your family, you talk to your provider, you have sort of like a care plan on what you expect your management will be at that point. And now this isn't something that they need to come to a decision right away. It's just an avenue for you to start a discussion about it. And this is something that I have ongoing with my patients. And at some point when they are comfortable, you know, there's some legal paperwork that they go through with their family to kind of have all the stuff taken care of, as I say. I say, get your ducks in a row is what I tell my patients most commonly. And that's important because, like I said before, it puts a lot of burden on the immediate family members to decide what what that person would want for themselves. And so this kind of helps negate that confusion, if any. So that's also an important part of it. Now, the biggest part of it is about education, counseling, and planning, and referring if there's any need. Now, if you go through, I don't know if you've all been to the CMS website, and all my stuff that I've kind of pulled up today to discuss with you is all from that website. So they have like a great booklet. The starting of that booklet kind of looks like this, and it says Medicare and You 2021 from the CMS website, which is the Center for Medicare and Medicaid Services. And they have a good program set up for the Medicare patients. And I individually was going through some of the things that Medicare Part B can essentially cover. And really, the provider cannot recommend all the screenings the first time they meet you, but they would try to introduce some of them, or at most they can for you. And then subsequent visits, which would be your annual wellness visits, they might go into the details. One of them, of course, is your mammogram. That gets covered once in 12 months. Typically, I think usually for the breast exams and the pelvic exams, that's usually once in 2 years. By the age of 65, majority of patients have had multiple mammograms and multiple GYN screens. Another one that probably at that point you've already had is your colorectal cancer screenings. So that's also something your doctor will discuss with you at that point. And then, like I said, the depression screening, that's something that we do yearly for patients. One that I did find recently that when I was reading through the package that I thought was quite good was to provide nutrition services. So Medicare will cover nutrition services if you have type 2 diabetes, But that's again once in a lifetime of a patient. So, but if you haven't had any screen or any counseling up until then, Medicare will cover it for one time, which I thought was quite good as well. And that could also apply to kidney transplant patients in the last 36 months, or if you've had kidney disease that they could apply to. Now, the diabetes screenings, they're not typically covered every year, but majority of the patients do have medical problems that the doctor will be able to check for it regardless. The EKG aspect, that's covered once in a lifetime under just the Welcome to Medicare visit. But again, if you have other comorbidities, that can help the doctor decide how often you need, and that will determine the coverage for that too. Other important part of the visit is also talking about vaccines. And in this day and age, vaccines have become more on the forefront in everybody's discussion. So Medicare covers flu shot yearly, and I do advise all my patients to get the high dose after the age of 65. You do not have to get it at the doctor's office. You can get it at your local pharmacies as well, and it's covered. The other one important vaccine that gets if you have a medical history, it's a different story. But typically at the age of 65, you would get the first dose of your pneumonia vaccines. And there are two pneumonia vaccines. You would get the Prevnar 13. That's the first one you'll get at 65. And at the second year, meaning your regular wellness visits, you'll get your second pneumococcal 23, which is the Pneumovax 23 at the age of 66. That's typically how it works. Now, with regards to vaccines, I believe they also cover for the hepatitis B vaccine if there is a need, and your doctor would determine if you need it to get it. The one I've noticed that they do not cover for, but we still recommend, is the shingles vaccine. Typically, it gets covered under Part D. So I usually tell my patients to get the vaccine for the shingles, which is a two-step vaccine from your local pharmacies. Again, I would always urge everybody to call your insurance company to verify that. And then the other screenings that your doctor might consider for you is hepatitis C screening and blood work, hepatitis B screening, and HIV screening. And there's a protocol that we have as how often we do check them. With regards to lung cancer, and especially with a person who've had a history of smoking, there's certain strategies that we do use to screen for lung cancer. And Medicare does cover for a low dose CT, not the regular dose, but the low dose CT once per year. And that depends on the age, and that depends on your smoking history, how much you smoked in the past, and how far has it been since you've quit. Obviously, if you have any acute symptoms, that management would be different. I talked about the vaccines. Another important thing is obesity and screening and counseling for obesity. So as we know, with regards to weight, it not only is just the weight a number, it has a lot more prognostic relations with your future and other medical problems and comorbidities that can happen with it. So providers will take time to speak to you in particular about nutrition, diet, and exercise. And really all of those go hand in hand. It's not separated. So that would be a good talking point to cover that and questions about that as well. Now, finally, I wanted to say, Medicare wellness visits, they say that it's covered by, or it is covered by Medicare, but I do have to say that if your provider is talking about other medical problems that you already have, or if they see, suppose they are doing a screening and you are coming up abnormal and they have to do further testing to determine what the issue is, then there will be a copay attached to that visit. So it won't be it won't be necessarily that it would be fully covered. It will be, but the copay might apply if they go into details with another medical problem. And so this is one of those visits that you'll get once in a lifetime, and it has to be done within that first 12 months of when you enroll to Medicare. And it's essentially like a sit down and a chat with your doctor. Now, a lot of providers, including me, also do our physical exams during that time. But I don't want to get into that and confuse all of you. Also, think of this as your sit down moment with your doctor, going into the details of your screenings, of your counseling, of immediate referrals that you need to, and then vaccines. That's another talk at this point. Vision screening is an important one. Fall screening, depression screening are the other ones that we talk about in detail with the patient. And then any further stuff, if there is that need to go into the details, then it would be considered a separate part other than just the broad spectrum of the Welcome to Medicare. Okay, I just want to make sure I don't miss anything. The other thing that I wanted to, I don't know if I mentioned already, was the EKG. Medicare does cover for EKG in that first visit, Welcome to Medicare visit. Unless you have other medical problems, then they can do it at a different time or at a different visit if the doctor or the provider seem that it's important. Anyway, let me see if there's anything else that I didn't cover that I wanted to. And then after that, we can take some questions. So I know this was a quick overview, but really think of it as your time to just sit down with your doctor, go through the nitty-gritty of your future planning and your screenings. And then depending on that, your doctor will be able to provide the necessary care for the future. And don't neglect that advanced care planning. I think that's a big part of the time that they take to sit down with the patient and kind of, because this is essentially the first time people talk about it, not necessarily making it a morbid discussion, but it's important to at least start a conversation about it. And no decisions are made straight then, but it's just an ongoing decision, so you can actively think about it and make the necessary plans if there is a need. With that being said, I think I'll take questions.
Thank you so much, Dr. John. That was so informative. So I just wanted to clarify. So when someone sits down for you regarding this physical, they can talk a little bit about advanced directives and those types of things, like that advanced care planning. That is something that comes up sometimes. Mm-hmm.
Yeah. So especially in all our, especially with the Welcome to Medicare and even with annual Medicare visits, advanced care plan, that's the one I was talking about. That's a big topic of our discussions. Mm-hmm.
Oh, that's great. That's so important. Would you suggest having, before this actual sit down, would you suggest people have a lot of the screenings completed by then so you can get an overall idea of how they're doing with things? What would be your suggestion?
Yeah, so usually when you come into offices, it depends on each office and how they're set up. But usually they do have, especially now with COVID, a lot of the screenings sent to patients' home the day before even for them to fill out. So we're not just using a lot of time sitting in the office filling out paperwork. And that usually is time efficient because then you'll be able to sit with the doctor and speak to them more regarding those issues rather than filling out the forms.
Okay, great. And I know somebody was saying, does it matter if you have straight Medicare, Medicare Advantage? Do most of those programs, to your knowledge, provide the Welcome to Medicare exam?
So Welcome to Medicare is an overarching thing. So if you have Medicare, that initial one will be that is your Welcome to Medicare. And if you skipped it, because that's only covered in the first 12 months, right? If you skipped it, that does not mean that you cannot get the regular wellness exams after years, in the subsequent years. But this one is a special one that they would give it to you because you're doing it within the first 12 months.
As long as it's the first 12 months. Okay. Because somebody was just asking about that. They're saying, well, I'm almost 67. It's got on at 66. So as long as it's in that 12-month period.
12-month period of when you enrolled.
When you enrolled. Okay. All right. Somebody just had a question like, what would you say is there a difference between an annual wellness physical and a regular physical? Is there a little bit more done for the annual one?
Yeah, we always get confused with the annual and the regular. So like, remember, wellness exams are usually sit down doctor appointments. Like usually, or the way that they've described it is like, essentially there's not even like a physical exam that the doctors are typically doing, but majority of us do it anyway because that is what we've always trained to do. And sometimes, yes, there could be a difference, and sometimes it just depends on the provider. So that's a question that I can't give you a straight answer on. But a lot of them do both the annual wellness and the regular physical at the same time, but that depends on your insurance.
Okay. Are these physicals, welcome to Medicare physicals, being done virtually right now or in person? How is that going, would you say?
Yeah. So they recently offered, I think with the whole pandemic, that they've kind of opened that up because, like I said, it's more of a sit down talk. But the only issue is with Welcome to Medicare, we need a vision screen. So that becomes a little bit of issue as to like how we can get that vision screen done if it is a true Welcome to Medicare package. So that one, I don't know each practices how they're doing. But if it weren't for that, I think if the patient has a blood pressure cuff at home, if the patient has, a pulse ox, or able to take your weight and your height, typically I think it would be okay. But some of them might get a little tricky.
Yeah, sure. And also, like, is there, does the office provide like kind of a summary of everything, like some paperwork or an email on all the on what the findings were regarding this physical, like a report?
Yeah, so typically most of the practices, especially with Valley, we already have a patient care summary that gets sent to the patient's portal. It might depend on when the physician finally finishes, maybe, but within the first 24 hours, they typically get a summary of what happened that day.
Great. And one just last comment, they said, so I guess you would need a decent amount of time to, in advance to make an appointment for this, because it does take longer than a typical appointment. You would suggest people.
I would say at least half-hour appointments. Some practices do even up to an hour. It just depends on each provider and how they're, what they're comfortable with. But this is typically a conversation.
Sure, a little longer. So people have to take into account sometimes they can't get an appointment in a week. It may take
this
time.
One, yeah, exactly.
Absolutely. Wow, that was really very interesting, very informative. Hope people take advantage of this because it sounds like it gives you a really clear idea of how you're doing and where you want to go.
And I agree.
One more question. Sorry, just someone had asked about the vision test. And it asks, does Medicare cover this or is it separate vision insurance? But it sounds like Medicare.
Yeah, so the visual screening is the basic visual screening that we have in each office. So each office is not equipped with the optometry or the ophthalmology level equipments. So ours is probably the vision screening on a Snellen chart, which gives you your letters type of thing. So in that sense, that would be our baseline vision screening that we do. And then if we see that basic one is abnormal, then we refer them to an ophthalmologist or optometrist or whoever.
Okay, and that would then they'd have to use their own, healthcare vision.
Healthcare vision plan.
Okay.
Yeah.
Insurance, sure. Yeah, I really also want to say this is so comprehensive. It's great, but also I always suggest people make sure that, regarding their own physical health or any type of health, you just bring in your questions in writing and maybe prepare, even though you're going to get that report, to also write down some things, because a lot of times it's hard to remember, especially when you're in a doctor's office, get white coat syndrome, or it's just hard to recall.
Absolutely. And that's why preparing early for especially when you're getting that moment to sit with your provider and talk to them in details. Some of these questions might be something that you might think about and then forget out of the whim, but preparing yourself and coming in helps the provider to kind of cater their talk to your need, and helps you come out of it that you've accomplished something.
That's great. Yeah, somebody had just mentioned something about the portal, and does it keep your history of immunization, surgery, and later referrals? And I know it does. if you
Yes,
do
it
have,
does.
it's great.
Yes.
It's very comprehensive. Yes.
Yeah, within the Valley system, they've had a good portal system going on. And if it's entered within any of the Valley Medical Group providers, it stays in the chart.
Okay, great. Well, thank you.